Hi, everyone. This is Dr. Diane Hayden, publisher and owner of Natural Nutmeg Magazine and Essential Naples Magazine. And I am excited to welcome you today to The Path to Healing, conversations with Natural Nutmeg and Essential Naples expert practitioners. We're talking today about all things hormonal imbalance, menopause, infertility, and I have an amazing group of experts on with me today that I'm super excited about. I'm going to go ahead and introduce everybody in just a minute, still letting a few people um, into the room right now. And what I'm going to do is I'm going to just introduce each of our experts with their short little bio, and then I will ask them to give a short description of their practice. We'll go around the room, and then I've got a bunch of great questions for them. But as I said, if you're just joining us right now, go ahead and put your questions in the chat because I want to make sure if you're an attendee, we get your questions answered. Also, if you see in the chat, all of our expert practitioners have put in their names and their contact information. So if you want to be able to reach out to anybody, you can scroll through the chat. You'll see everyone's name, contact info, website, all of the above. So make sure that you go ahead and jot those down if you want to reach out to anybody after the call. I am recording this, and this will be sent out probably early next week to everybody. So if you want to review it, you can, and you'll have all the contact info there as well. So I am excited today to have on this panel our group of six. We have Dr. Lindsay Maher. She's the visionary founder and co-director of Soleil Holistic, where she serves as a naturopathic doctor with a master's of acupuncture. She's currently pursuing board certification of the American Board of Oriental Reproductive Medicine and a fellowship with the American Board of Naturopathic Endocrinology, enhancing her comprehensive approach to hormones, fertility, and reproductive health. So, Dr. Lindsay, how are you today? Just tell us a quick little bit about your practice.
Sure. Thanks for having me, Diane. So for those of you who don't know, my practice is a fairly integrative one. And I mean that from a holistic perspective. We have a nurse practitioner, we have two other acupuncturists in our office, as well as another naturopathic doctor and a registered nurse. And what we pride ourselves on is an integrative and collaborative approach to care. So we all share patients and we give various perspectives so that we are not missing any components to our patient's health.
Awesome. Thank you so much. And we have Dr. Michael Dubin. He graduated magna cum laude from NYU and attended Mount Sinai School of Medicine. He completed his residency at Montefiore and Mount Sinai Hospitals and obtained his endocrine training at the Albert Einstein College of Medicine, Montefiore Hospital. He's a clinical instructor at that college, is board certified in diabetes, endocrinology, and metabolism, and has been in private practice since 2003. And he finished his functional medicine training in 2024. So welcome, Dr. Dubin. How are you today? Just tell us a little bit about your practice.
Thank you. Doing great. So I've had traditional endocrinology practice since 2003, and I am literally just in the very beginning of opening functional medicine practice with emphasis, obviously, on endocrinology, which is my area of expertise. And so what I'm offering is hopefully the best of both worlds, traditional medicine analytic approach and to interpretation and management of hormone, but also wider, more holistic approach that is the cornerstone of functional medicine. And by combining both, I'm hoping to offer something unique in Fairfield County.
Awesome. Thank you so much. And coming to us from Sarasota, Florida, Dr. Carol Roberts. She graduated from Harvard University and the University of Texas Medical School. She's practiced surgery for 10 years. During much of that time, she practiced and taught the principles of healthy living. In 1993, she opened an integrative medical practice and is now practicing at Best Medicine out of Sarasota, where she provides nutritional counseling, natural hormone replacement therapy, peptides, and anti-aging medicine. Welcome, Dr. Roberts. Just tell us a little bit about you and your practice.
So I want to say a shout out to Dr. Dubin because I also went to Albert Einstein.
Great.
I was ENT many years ago.
Okay.
I fell off the edge of the earth and I started doing good medicine back
Yes.
in the 90s.
Right.
So welcome to the club.
Thank you.
What I do now, I do a large amount of longevity medicine, including hormone replacement and thyroid and adrenal work. And I'm using peptides. I'm offering thermography to my patients. And I'm also doing an in-person group class, which is 2 hours a week, where we can really get into how to change and where to begin when we can't really do that in an hour's visit. So I'm excited about the future and continuing to do what I've been doing.
Awesome. Yeah. One of our pioneers for sure. Okay, next up, also from Florida, in Naples here, is Francesca Scarbo. She is the owner of Balanced Nutrition in Naples, Florida, and has developed a passion and a proven process for helping people set and accomplish realistic nutrition and health goals, taking into consideration their lifestyle and health. She is an accomplished cookbook author, has a master's in clinical nutrition and multiple certifications in integrative nutrition, gut health, and hormone health. Welcome, Francesca. Can you tell us a little bit about your practice?
Hi, thank you so much. So yeah, I'm super excited to be here. My practice is based, I'm a nutrition coach. So basically what I do is I customize nutrition plans that are based on my clients' individual health needs and their lifestyle. So think of it as personal training for your nutrition plan. So what I do is I take the individual and I discuss with them what it is they're looking for and what they need to improve on. I work with a lot of concierge doctors and just like you guys, some hormone health doctors in the area, and work with them on how to use the food to help their bodies see results and to improve autoimmune, inflammation, gut health, and additionally to lose weight. So it's a one size fits you approach to health and wellness. And the clients that I've worked with all feel that they're actually enjoying the program because they're actually eating food that they like. So it's a customized nutrition plan based on you. So it's not a diet, it's a lifestyle.
I love it. Yeah, that's awesome. Thank you. And Ami Choksi has over 10 years of health coaching experience and has spent the past 8 years working with women and couples who are trying to conceive. She's board certified as a health and wellness coach by the National Board for Health and Wellness Coaching and attended the Institute for Integrative Nutrition and Next Level Functional Nutrition. She is a member of the American Society for Reproductive Medicine and is a peer support group leader for Resolve New England. So welcome, Ami. Can you tell us a little bit about your practice?
Thank you, Diane. So my name is Ami Choksi, and I'm a fertility and IVF coach. I work with women and couples who to help them optimize their overall health, so mind and body, to improve their chances of getting pregnant and staying pregnant, and both with and without. I work with people who are both going through IVF as well as not. I do work for a fertility practice here at the Center for Advanced Reproductive Services, and also have my own private fertility coaching practice. And so a lot of my clients are going through IVF, but my goal is to help you or to help my clients understand what else they can be doing to support their health alongside their medical care.
Awesome. I love that. Thank you. And Dr. Deanna Sharon founded the one size fits all approach to treatment in conventional medicine. No, that's not right. Found that the one size fits all approach to treatment in conventional medicine often failed to adequately search for and address the underlying cause of symptoms in herself and in her patients. For this reason, she chose to study and then establish her functional medicine practice, Natural Health and Healing. Dr. Sharon is certified in functional medicine from the Institute of Functional Medicine and has been practicing for over 18 years. So welcome, Dr. Sharon. I'm like, one size fits all approach. That doesn't sound right. Tell us a little bit about you and your practice.
Hi, Diane. Thank you. Yeah, so I've been practicing functional medicine since 2006. I met Diane really early on in the process, and she was really instrumental in helping me get my practice off the ground. I found that bioidentical hormone replacement, I have to say I was really sort of suspect when I first started learning about it. Obviously, coming from the conventional world, I was trained in internal medicine. But when I saw the results and how it really helped my patients get the motivation, the energy to do what they needed to do for their health, I really was sold on it. And then also really seeing how symptoms lined up with the salivary hormone testing that I was doing. So that's a piece of my practice. I do a lot of Lyme, mast cell activation, mold toxicity. So my practice has really kind of grown as our knowledge has grown in these different areas. And yeah, I love serving patients and helping them get to the bottom of their symptoms. And I find the functional medicine approach just really helpful in allowing me to customize therapies based on the testing that we do.
Awesome. Thank you so much. And that kind of rolls me right into the first question I was going to ask our panel. So, what are your thoughts on bioidentical hormones or hormone replacement? You know, it's everything from, gosh, what's not out there? Pellets, estrogen patches, creams, supplements, all that kind of stuff. So, you guys, just tell me, Deanna, let's start with you, I guess, because you kind of rolled us right into that question. And you said, you were skeptical. So obviously, I mean, what was it that actually made you comfortable enough to try it? Because you said you started seeing results, but you still had to kind of get past that skepticism, I think, to go there with patients, right?
Yeah, I think what really helped was I actually fortuitously met a compounding pharmacist at a first line therapy conference. And we just started chatting, and he told me about what they were doing, and basically just started me on the path of education about the whole process of, learning about and prescribing bioidentical hormones. So, yeah, and I guess, the thing, like I said, the thing that really sold me when, and we never have done salivary hormone testing in conventional medicine for hormones. So, again, that's where I sort of was, wow, is this really? But when I saw how well patients' symptoms lined up with their results, and then started, customizing therapies for patients based on the results, seeing their the positive benefit of it, I just really became sold on just how important. And the more I do training, I was recently in November, attended a personalized medicine uh, course on endocrinology for 3 days. And when we really drill down and look at how hormones impact every aspect of our health and how they really, when our hormones are balanced, can really help us prevent disease and control disease states. It's really just an amazing, amazing thing. And we're just really not taught how everything's all interconnected and interrelated. And but it really is. And I think the bioidentical hormones are really a game changer for a lot of people.
Awesome. Thank you. Yeah. Anybody else have any comments on that?
Well, I can say my big aha was when I went on them. And they did such good things for me. I couldn't, that's how doctors do things. We try them on ourselves first. So I was at the point of premenopause where I was still having periods, but I was symptomatic. And so I started using bioidenticals, and that was quite a few years ago. And I will fight anybody who wants to take them away from me because they've been so wonderful for me and for hundreds, maybe thousands of patients since then. So experience with them is what has convinced me.
Yeah, for sure. There's a great question that just came through. I just want to jump to this. Are bioidenticals safe for someone where there is family history of breast cancer? What are your thoughts on that?
May I?
Yeah, go ahead.
Absolutely. Absolutely. Uh, There are many studies coming out now that not only have debunked the 2006 Nurses Health Initiative, but have shown that using hormones is actually protective, the bioidentical hormones. If you've got unprotected hormone receptors, then any pesticide residue or heavy metal or any other hormone mimic can take up residence and tickle your receptors in a bad way. So it turns out it's protective. And I use them in people who have had female cancers or hormone-related cancers as well.
I think bioidenticals, just as a disclaimer, in Connecticut, my license does not allow me to prescribe, but I do work in tandem with my nurse practitioner. But I do think that one of the things that about bioidenticals is that it truly brings back the art of medicine, because everybody is so individual and there's no standard of care when it comes to hormones per person. And so I think when choosing to work with a provider who's doing bioidenticals, it's very, very important to do your homework on who that provider is and how, and interview them. You know, just as much as you're in kind of the hot seat as the person who is in need of their care, you also need to ensure that you're comfortable with that physician or provider's approach, because there, again, there's no one size fits all in a lot of what we're going to talk about, but specifically when it comes to hormones, I think.
Yeah, that's a really great point.
I think the answer to the question, are they safe, is a very individual question. You know, there's family history of breast cancer and there's family history of breast cancer. There's certain familial breast cancers associated with high risk of cancer and aggressive at times, and there are markers and genetic markers for them. So this question probably cannot be answered uniformly as a positive yes. It's just that it's more like yes with certain caveats. I think I would introduce a little bit of caution, but definitely when we're talking about female bioidentical hormones, they are definitely safer than synthetic, and it has to do with how they're metabolized and how synthetics are metabolized. They produce metabolites that are very carcinogenic potentially. It depends on which pathways. There's several pathways, and there's 16 and there's 4. And so the process of elimination of synthetic estrogens can produce and does produce often carcinogenic metabolites, whereas bioidentical, just estradiol, does not, and in fact can be mildly protective. So, and just one quick thing, when we talk about bioidentical in general, just keep in mind that certain hormones that are synthetic in the world of endocrinology are literally bioidentical. Thyroid hormone, for example, synthetic thyroid hormone, atom by atom, it's the same thing as produced by your thyroid gland. Or insulin is virtually exactly the same as produced by your body. So we have to keep that in mind if we're talking about bioidenticals as a group versus female bioidenticals or estrogens, where here definitely they have an advantage over synthetics.
Yeah, I think the point is, as individualized as possible. I mean, when I was reading a lot of your bios, like that was the word that kept coming up, right? Like it's not a one size fits all. It's individualized, it's personalized. That's what we're finding now, that's becoming more and more important. I want to switch to, let's talk about foundations. So, what are good foundations? Like how do you guys practice in terms of a good foundation, whether it's for for fertility, or whether it's for, women that are moving into, premenopause, menopause? What are good foundations? So I'm going to move to a couple of the people that are doing more practice specifically more with nutrition. So Francesca, let's go to you. What do you recommend as far as like a good foundation?
I think the first and foremost is we need to make sure that we look at the individual's lifestyle and see what their stress levels are like first. Because, you can have a pretty decent eating plan, but if your stress levels are high, your cortisol levels are high, your adrenals are running extra fast, your gut health could be off a little with all of that. So that could actually affect the types of digestibility that you have with certain foods that we're putting on some of these, some of the plans. So really, I want to always start with the foundation of that, and then kind of take a look at what are the foods that they're putting into their bodies. Are they pro-inflammatory foods? Are they, more processed types of things? And then I look other things. What's your hydration like? What's your sleep like? Nutrition's not just about the food you eat. It's also about obviously our lifestyle, because, certain things that we do during the day could affect, again, like I said, our digestibility and how our body metabolizes things. And, our adrenals are super important, especially in the hormone health work that I've been doing with some of these people. Knowing, where we're at, like, because again, I can prescribe and give a great nutrition plan, but if the fundamentals of their lifestyle aren't there, then, that's usually that just won't be balanced.
Right. Yep. That's great. Great advice. Ami, how about you?
Well, we're gardeners in our family, and I used to talk to my son about what it takes to grow a fertile garden. And this discussion centered around pulling the weeds and tilling the soil and adequate sunshine, enough water and nutrients and TLC. And that's pretty similar to what we need to create a good foundation for fertility. So focusing on whole foods in a way that supports your blood sugar, staying hydrated and not necessarily with super sweet coffee drinks. I'm talking about water, and getting enough sunshine daily, moving our bodies, creating that circulation and reducing the stress from moving our body when it comes to moving our bodies. And then giving it TLC. How do we manage stress? Are we sleeping to recharge our batteries? And how do we incorporate self-care in there as well? And the final thing, when we're talking about pulling the weeds, reducing toxic exposures in our bodies as well. And so being mindful of what's in your food and water and personal care products.
It sounds like a lot of similarities. So let me just ask you this, because you're the specialist with one of them with fertility. Is there anything different that you would do when you're working with somebody for, fertility, foundation for fertility versus, let's say, foundations for hormonal imbalance for someone who's going through menopause?
May I have your attention, please?
So I don't necessarily focus on menopause, but I do focus on, when it comes to fertility, hormonal balance, I think is integrated into that. So,
I don't know who's I don't know who's having a fire alarm or who needs to leave their building. What? All right, go ahead.
No, I think that fertility is related to hormonal balance, and everybody's that, but maintaining optimal blood sugar and getting those foundations, I think, is critical. And that's just the base of it. So then we will go a little further and look at their habits.
Okay, great. So Lindsay, how about you? Let's from the fertility aspect, because you probably do a lot with acupuncture around that, right?
Yeah, it's one of the modalities that I think is very helpful in achieving desired outcomes.
Awesome. That's interesting, because I think most people probably are not aware that you would use acupuncture for that. And is it more for stress reduction, or is it about the energy flow, or what would you say?
So kind of similar to what everybody else has said thus far, whether it's fertility, hormonal imbalance, or perimenopause, menopause, I like to see things kind of as a three-legged stool, because without the other two legs or the one leg, it's always going to fall. And so some of those foundations are like managing stress, lifestyle, diet, as well as, yes, balanced hormones, but also your environment. And that could be relationships as well as just the world around you. So for me, and from an acupuncture standpoint, it's similar to how we view the person from a conventional Western approach. I do like to follow their cycles. However, it's a little bit more than that, because the theory behind traditional Chinese medicine takes a little bit of a different approach, because it's trying to work on the body's energy from the inside out, I guess you could say. Whereas we all have the power to achieve the goals that we're kind of setting out, but sometimes there's just an impedance somewhere. And from acupuncture, it could be energetics, But the way I look at it is I kind of break it up into 4 sections of the female or the woman's cycle. So we want to catch the bleeding phase. We want to catch the rising estrogen phase. We want to catch the ovulatory phase, and we want to catch the increasing progesterone phase. And so all of the goals within that are to achieve um, optimal totality of those. So free flow of bleeding, or is there pain? Is there clotting in the blood? What's the color of the blood? We want to make sure that we're achieving optimum outcomes there. When estrogen begins to rise again to achieve ideal ovulation, we want to make sure that we're supporting that. And when it comes to ovulation, we want to make sure that we are ovulating the ideal soon, like preferably what's going to become the embryo upon fertilization. And then when it comes to, because that 2-week window, the body assumes pregnancy until it proves it's either is or not. We want to make the home of the uterus to be the best implantation for that embryo. And then when it comes to when we get the positive pregnancy test, ideally, we want to support that at least for the next 10 to 12 weeks. And then I kind of like to support my ladies symptomatically throughout pregnancy.
Awesome. I love that. So one thing that just came up that maybe people might have found interesting or even surprising that they didn't know of is, what is the impact on gut health on hormonal imbalance? And I think we're seeing more and more of this now coming out, but I think it might still be surprising to people that, how does gut health really impact my hormones? So any one of you wants to jump in on that one?
So your gut is your second brain, right? So I think that there's a lot of people that are experiencing such, I mean, from what I'm seeing, horrible gut dysbiosis, just stuff that's going on that they're not sure of. Why am I so bloated? Why am I fatigued? Why is my skin acting the way it is? Even with certain people I've been working with, their cycles are a little off due to some of the stuff that's going on with their microbiome. Not many, but a little bit. And I think that with the gut, there's so many powerful microbiomes that if we're not addressing how to heal that and how to calm that, that also leads to other like stressors too. Because if we're like eating stuff that's causing high sugar levels, or it's causing the thyroid to be a little bit off balance, things that are like stuff that's even hard to digest. A lot of people don't even know that they have certain types of, food sensitivities, or certain things are causing, like, we'll use the 3 that everybody knows: dairy, gluten, and sugar. Like those are the 3 that usually like activate the gut to react in a certain way. So I really do think that in all of my clients, I always kind of talk about the gut first. Like, what's your daily bowels like? How much hydration are we doing? What's your fiber content? These are just a few tag things that I like to work with. And once we kind of dissect that, and we realize that they're having such a pro-inflammatory eating plan, they're skipping meals, they're not hydrating, they're over-exercising, so therefore they're highly stressing their bodies. When we calm that down, there's some really powerful stuff that happens.
Yeah. I'm glad you mentioned over exercising, because that's a big one too. I think, like, especially for women, it's like, for a long time, I think we all thought more was better. And now we're finding out, no, like, that could be such a stressor. It's crazy to think that exercise can be a stressor, but it can.
Well, just to flip the switch from nutrition to exercise for a minute, there's a lot of women that are in their mid 30s and up that are having I'm seeing them now. They're like, I have this pooch. I don't know what this is. Yes, it is the nutrition, but it also, so many people are exercising. We need to change our exercises as we age, myself included. I mean, I was a marathon runner for about 10 years, from my early 20s into my, pretty much my early 30s. Then I needed to worry about bone health, and then I needed to worry about all that. So I started to cut back on some cardio and increase my strength. Then as I hit my 40s, I started to cut back on strength and do a little bit more what I like to call kind of mind body training, which is more like Pilates with resistance and, a little bit less cardio, a little bit higher resistance, lower reps. But strength training is so, so important. The over exercising, I see with people just again elevating their cortisol levels, and they're not able to get their metabolism to jumpstart the way that they want.
Yeah, that's true. That's really true. Anybody else have anything they want to say about gut health?
Well, I just want to say,
Go ahead, Carol.
thyroid has a direct effect on motility. And so if you're hypothyroid, you're very likely to be constipated. And when the sewer is stopped up, the whole house stinks. So that's not a good place to be. And that's fairly easily correctable. So I'm not sure about the connection between the sex hormones and the gut. There is some, and it's pretty subtle, but you can have good gut health even in postmenopausal years. So it must be a more nuanced connection there.
I tend to run functional stool analyses, and sometimes I also run it in tandem with the Dutch metabolites, because both actually make a suggestion that the other one is necessary. So there's kind of I guess, a very transient association. However, I always, from the 3 steps of detoxification, it's phase 1, 2, 3. But in order to really optimize all of those, I go 3, 2, 1. And so, to your points, if you're not eliminating, it is getting stocked up, and it is facilitating those hormones from choosing the 2 or the 4 or the 16 pathway. And so I have solely worked just on the gut health and have found, and then run hormones after like 2 to 3 months, and have found, without even doing anything directly with hormones, they have come back into a more ideal balance.
That's great. Deanna, did you have a comment? Yeah, go ahead.
Yeah, the other thing I was going to mention, sort of coming off of Lindsay's point, when we talk about estrogen metabolism, so the things that can help move that estrogen into a more healthy metabolism are fiber, cruciferous vegetables, omega-3 fats. So, again, it's sort of an indirect way of how the gut, plays an important role. And as Lindsay mentioned, the stool testing that we do actually measures something called beta-glucuronidase, which is an enzyme that when it's elevated, can actually result in the recirculation of hormones and toxins in the body. So there are, everything is interconnected and interrelated. I think a lot, as Carol said, is, there is nuance, but there are connections on how everything fits together.
Awesome.
Yes, I would like to echo that absolutely. And so that those 3 metabolites of estrogen that I mentioned, the toxic ones, are cleared with the help of fiber, which fiber, even it's not necessarily digestible by the humans, it's digestible by your gut microbiome, and then your gut microbiome participates in removal of these potentially toxic metabolites of estrogen. So it's very, very important. And overall, the overarching picture of the gut, you can see gut as the interface between outside and inside. One of the interesting reframes that I've heard is, once you eat your food, it's still kind of technically outside of you, not inside of you, right? It's only inside of you once you absorb it, goes into your bloodstream, and then it's literally inside of you. And so the border, the lining of the gut, is a protective mechanism against toxic substances entering your body, unnecessary substances entering your body. And if you interrupt that lining, all hell, so to speak, breaks loose. And specifically, when you have standard American diet, pro-inflammatory diet, processed foods rich in sugar, the 2 things happen. You literally mechanically interrupt this lining, and a lot of things are not supposed to enter your body. Toxin, estrogen, endocrine disruptors enter your body, creates inflammation that spills over literally everywhere else, including your brain, blood, joints, and so forth. And also, that very same diet is very detrimental for the gut microbiome, which is super important for every aspect of the body. And it's replaced by organisms that are not helpful at all and quite detrimental. So you have multiple hits, and all of those things downstream obviously affect hormones, cortisol, and the rest. So nutrition is super important.
Definitely. Yep, definitely. So I'm going to ask this question, and I know that it is a very individualized answer, but if you had to pick one, like your number one strategy, what is your number one suggestion for treating hormone imbalance? Maybe like the first thing you would tell your client or patient that they needed to do.
Go ahead.
Oh, I was going to say my clients are often women who are highly stressed, already going through IVF, and they're looking for ways of things that they can control. And I typically go towards one thing that I think is most important is ensuring that you're eating in a way that supports your blood sugar. So, keeping your blood sugar balanced, because not only does that support your physical health, it supports your mental health and reduces spikes that create mood swings and fatigue.
Right. And it's amazing how many people don't realize that keeping your metabolism balanced reduces stress. I don't think people put that connection together. And when I've worked with functional medicine doctors for like just, things that I've had, that was pointed out to me that you probably really should be eating meals. Again, it's individualized based on the person. But for me, like every 3 hours, no more than 4. And I was like, wow, that seems like really close together. But it's just amazing, like how that, once you get your blood sugar imbalanced, how that can even add more stress to the body without you even like thinking about that.
I would say, again, very holistically, if there's one thing besides finding a good, knowledgeable doctor, but if you're looking at one thing in a very general sense, look at the root cause. Don't look at the symptoms as a starting point. The foundation of functional medicine, as it should be, foundation of medicine as such, but unfortunately it isn't. You need to identify root cause. So you need to explore all the major parameters: sleep, exercise, nutrition, not necessarily in that order, it doesn't matter, or stress, relationships, spirituality. I mean, it might sound corny, things like, what's the meaning of life? Obviously, we're not going to answer that question here. But all of those things are important. We're not just a bunch of molecules, undergoing biochemical reactions. I mean, it's one way of looking at it, but it's undeniable there's also something beyond that, a psyche or a spirit. All of those things need to be addressed. And, if you talk about infertility or if you talk about men's health, doesn't matter. Good health is good health. It's good for everything. But there's certain foundational things that contributes to good health. We mentioned them multiple times. Root cause is what needs to be addressed. And if it's not, you will give. It's like if you have pneumonia, it's important to suppress the cough, but more important is to treat the bacteria or the virus that causes it. Otherwise, you're not really treating the patient fully.
I love that you brought up spirituality too, because I think everyone on this call is in agreement with that. No one would think that that is weird. It's such a huge thing, and we didn't even like. That's a whole nother podcast if we could talk about like how does your energy and what's going on your emotionally and all that affect everything that we're talking about. So thank you for that. All right, anybody who's next?
I was just
go to?
Oh, no, Deanna, go ahead.
Okay.
Well, I was just going to say that I think, of course, the lifestyle that the foundations of health are really important to address. However, I just have found that a lot of patients come to me and they're like, I can't get out of my own way. I don't have the motivation. I don't have the energy. I don't have the willpower to do what I need to do. And I have just found that when we address the root cause, the hormone imbalance being one of them, that suddenly patients, they're sleeping better, their stress is less, they have the motivation, they have the willpower. It really is an important piece of the puzzle that I've just found, to be really transformative for people.
I love that.
And I like to connect with the patient and let the patient know that they're in charge of their own health. I'm on their team, but they're the captain.
Mhm.
So, right. I deputize them to change their dosage if they need to. I explain to them how to do that and when to do that. And we kind of make an arrangement, an agreement, a negotiation where I'm not in charge of their well-being. They are. And I'm just kind of like the tour guide.
Mhm. And then one of my approaches, and it's pretty synonymous with like what everyone else has been saying, but I like to remind my patients that we're primitive beings living in a modern world. While technology has increased and evolved exponentially, we are still stuck physiologically in a little bit of a time warp. And so that means the synthetic and artificial lights that we're exposing ourselves are just not conducive with human physiology. So getting daylight, sunlight, turning lights down in the evening, getting even blue light blockers, because we know we still have to exist in the modern world. So I don't want to take that away from people. But understanding that, in the winter, it's okay to feel like you're tired and want to hibernate it when it's dark outside and save your energy when the days become longer. So getting in tune with the circadian rhythm, sleeping when it's dark out, waking when it's light out. There's a lot of people who go against their physiology and wonder why they have some imbalances. I think there's a research that has proven that shift workers, just by working in opposition to the circadian rhythm, have higher degrees of metabolic syndromes.
And people in Alaska too, right?
And the days of
Yeah.
the year where it's only 4 hours of sunlight, sure.
I love that though, because I think you're exactly right. We go against, like when we're in the northern part of or anywhere really during the winter, like you're saying. I mean, we get more daylight down here in Florida, probably in an extra hour than what you guys get up north. But still, it's the sun's going down around 6:30 or whatever, which is not summertime when it goes down at 8:30. Yeah, we should be relaxing more, cocooning more, all that, but it's so against just like our society today and the amount of work that we have to do, right? So I think that was a really great point to make, that it's okay to slow down in the wintertime, right?
Yeah, for sure. I
Yep.
think we're so used to I always say, just because someone else is going 100 and you're going 85 doesn't mean you're going slow.
Right. Yep. I love that. Okay, who's next?
No, I was just going to jump in and say that I was speaking to a patient of mine the other week, and she's in her 70s, and she was a school teacher. And so every morning she's gotten up at 5:30 in the morning, and she continues to do that even though she's no longer teaching school, right? And so we were having a conversation about her sleep and, the fact that it's not not optimal. And so I said to her, I said, you don't have to get up at 5:30 anymore. If you don't have a good night's sleep, sleep in a little bit. I mean, but we're so programmed that it's not okay to sleep. Sleep is a waste of time. Yet, if we think about it from determiners of health, it's probably up there in the top 3. So really, really important.
Yep. Yep. We've probably all heard the saying, "Oh, I'll sleep when I'm dead." Well, if you don't sleep, you might be dead sooner.
My analogy has always been with a cell phone. Like, if you don't charge your phone and it dies at noon, you don't need a new phone or a new app. You need to recharge your phone. I tell them sleep is what recharges literally your health. I mean, I've clearly understood that well before I took functional. It was just fairly obvious if you just talk to enough people what happens. And there's a reason why, sleep deprivation is a form of torture. Just think about that. So
That's true.
True.
you don't have to go to medical school to understand it.
Yeah. Which is so crazy, right? You guys are being trained to be the caretakers of us, the community, and they don't let you sleep.
Right. Well,
Yeah,
Yeah, it's a badge of honor not to sleep.
exactly. Exactly. All right, did I get everybody? I feel like Francesca, you went? Okay.
No, I think everybody said all the same stuff. I just think that, we are, our society is always like the harder and the faster we push, people think we'll just get the best results. And that's not always the case. And I think that again, we talk about bioindividuality. Everybody's different. Everybody has a different way of kind of going through their days and finding what they need. But I think we kind of get caught up in the social media world of, oh, I want to do what everybody else is doing because they seem to be healthier or they seem to be doing this. We have no idea what anybody else's stories are. So I think as a whole, I mean, we're all in agreement with how this all should be working for people and how it's been working for our patients. It's hard to break habits, especially when we've been doing the same things for so long. I mean, I work with some of my clients now that have just been on such poor habits and it's also lack of education. We don't know what we don't know. So, we want to make sure that, especially when we're working with people, that we give them the best tools possible. And, we try to always remind them that, like, again, like we were talking about, it's okay to like take a step back, reevaluate life. I mean, I know personally, just to share a story, I came down here from a high stress job in New Jersey. My business was shut down from COVID. I had to hit reset. I had to learn how to breathe. And then when that happens, everything just kind of fell into place. My health got better. My energy got better. Learning to have better quality sleep, learning to have better relationships. So it's all intertwined.
Yeah.
100%. I mean, I do a lot of men's health, and I can't tell you how many men come in and they just have the unhealthiest lifestyle there is, and then wonder why, either the equipment doesn't work or libido is low. And you just have to start from scratch. And like you said, it's just not stressed at all. Like nobody's
Right.
yelling from the rooftops. You got to have good sleep. You got to have, it just doesn't happen. So you have to do it one-on-one.
Right. And then I feel like what happens too is I think there's such a place for hormones and for HRT and for, peptides and for everything that we're talking about. But I think that a lot of individuals are looking at it as the easy way out. Like, oh, I'm going to do my injections. I'm going to feel great.
Yes.
It's like, yeah, but that's only like the most microscopic piece of the puzzle. And then when they come to me and they're like, I don't understand why it's not working. And I'm like, well, it's probably working. We just need to figure out everything else first. And with the nutrition side of it and the exercise side, since like I said, I do both with the nutrition, it's really like we are all talking about, getting enough lean protein, the timings of your food, what your body is lacking as far as its nutrients. Are we making sure that what we're doing is getting absorbed and not getting just kind of expended? But I definitely think that that the hormone world needs to kind of take a step back too, to educate on everything we're talking about, the pillars of life. And then we can really, because I just think people are either taking too much or they're trying different things to see quick results. And that's just not how it works. It takes a while to get to point A. So again, that's why I think it's good to formulate baby step habits.
I couldn't agree more, because very often there are diseases in endocrinology where the root cause is hormonal alteration. You have a tumor that overproduces certain hormones and then it all just goes down. But in most people, it's actually the violation of foundational principles that we talk about. That causes often dysregulation of hormones downstream. But if you just start there instead of the root cause, you'll never fix it, because the root cause is always going to be there, right? And then it'll always create a problem somewhere else. You fix cortisol, maybe, okay, right. But then what else is happening that you're not addressing? And if somebody is hitting you with a baseball bat and have a bruise, well, the problem is not, going to a hematologist to address the bruise. You need to be, stop being hit with a baseball bat. Bruise is not a problem. Baseball bat is. So, and that's what people don't hear that. So, oh, your testosterone is low. Your estrogen is low. Like nobody asks why and what can we do about it. Well, here's a prescription for testosterone injection. That's how it works.
Yeah, I mean, that's what it is though. Like a lot of people just want the quick fix, and it's not even, I think when people start to realize that we really need to start looking at you know, what are the small steps I can take today? At least like one small step that I can take today. That's going to get me closer to better health, less stress, better eating, like one small step. I think maybe it's just that we look at all these different pieces that we're talking about and people tend to get overwhelmed. Like, oh my gosh, I got to change my diet. I got to exercise. I've got to take supplements. I've got to do the hormones. I've got to meditate. it's like the list is like, now it becomes this whole list, right? Like of everything else that we have to do. It's like, how do we just take a step back and be like, okay, one thing, like I'm going to do one thing today.
That's exactly what I teach.
Yep.
If you talk about bad habits, I do a lot of diabetes. It's like, okay, if you can't get rid of all the carbs, right? Okay, fine. Start with one. You start your biggest offender, address that for 2-3 months solid, then move to the next target. And it's going to work like that with anything. Sleep, identify what's the most egregious problem that is violating your normal sleep patterns. Address that first, and then move on to the second. You don't have to hit all the problems on your list. Start with one and proceed. And my role would be to guide, okay, we achieved that goal. Let's move to the next milestone and so forth.
And sometimes it's not even doing anything specifically, it's an actual undoing, because we're also working against a gradient here where most people have heard things for so long that when I at least know in my practice, when they come to me, I sometimes look like I have 16 heads because I'm telling them something that goes against everything that they've been told up until this point.
Yeah, I've seen that from day one, 100% agree. Yes, especially with diet. Yeah, I don't have any hair because I tore it all out, arguing against food pyramid.
Yeah, and that fat is bad. And all the things. Yeah.
Honestly, in so many of the talks I've been giving over the course of the last few weeks, it's really miseducation. There's so much misinformation on the internet. And who's doing Dr. Google, who's doing the WebMD, who heard from somebody, who's putting out like short reels on YouTube of just their own personal experience. Again, bio-individual, everybody's experience is different. And when I do these talks and you talk, like you had just mentioned, fat is bad. I only do low fat diets. I don't do full fat, dairy, carbs are bad. We talk about the seed oils. There's so many things that they talk about. And when I try to, ease the stress of it and try to make it as clear as I can, because again, not everybody talks in our lingo. Trying to understand or get people to understand what it's doing to their body or what's better, what are some alternatives. The first answer I'll get is, how come nobody told us this? So, and it's true, but we're not educating on just like the little part. We're doing the big thing, and that big thing has taken years to find. And then it's like, how do we dissect that into something small, which is, what I've been doing again with a lot of the patients that I work with. And once they kind of understand one thing, then they pick it up with other little things and more. So it's like a cumulative thing over time.
But it's a journey. You don't fix anybody in one day, even if you spend the whole day. It's a journey. It's a marathon. It's not a sprint. And so you need repeated visits and adjustments. And, so that's where, and unfortunately, it's not always possible with the basic insurance models where they pay you for whatever little amount of time. So, you need to cultivate a relationship with a patient, trust you, and they see the difference. And so then they're more open to change.
So
what
as we
I'm hearing, I'm sorry.
No,
what I'm
Carol,
from
I'll get
everybody.
you.
Did you want to talk?
Yeah, I just want to say one thing because we're kind of wrapping up to the hour. I'll come right back to you. So for those of you who are attending, all of the I don't think the contact information came through for people. So if the attendees want to put their contact information in there one more time, please. And I also have copied it, so you will get it when I email the recording out. And also, if anyone from the panel has any offer that they want to put in or offer to the group, they can put that into the chat now as well. And Carol, I'll go back to you.
Okay, so I was going to say that it's not all about treatment. It's more about education, which everyone is saying. And education in self-care should, but does not start in kindergarten. We're not creating self-motivated, healthy people. We're creating consumers of the prevalent culture, and our culture generates illness. So it's really an educational process to teach people that prevention beats rescue, and that you yourself are the most important person in terms of determining your future health. If you start today, you'll be better off tomorrow.
Yep,
I'll leave it at that.
totally agree with that. It's all about responsibility, right? We got to teach people they have to take their own responsibility for their health. That's the thing. All right, before we finish up, anybody else have anything they want to add? We got to the end of the internet. That's it. Lindsay, go ahead.
No, I think that you pretty much covered it from soup to nuts. Of course, this conversation could go on forever, but that's why you have allowed us to include our contact information. So if anyone does want to continue the conversation, you have the ability to do so.
Great. That is awesome. Anybody else have any other questions? I don't see anything else in the chat right now.
Well, thank you for putting this together, Diane.
Yes, thank you very
Thank
much.
you.
Thank you very much. You guys are all incredible. Let's keep educating, motivating, inspiring, and doing all great things for the future of the health of our patients.
Amen.
Awesome. Yeah. Well, I'm so glad for all of you to be on today and giving us your time and all your great information. I appreciate that. And it's something I've been wanting to do. I've been wanting to do these calls for a long, long time. And finally, I'm like, all right, this is the year I'm doing it. And so we've gotten amazing feedback.
We should do it more regularly.
I do them once a month.
I got it.
Yep, once a month. Otherwise, I'd have to clone myself. All right. Well, thank all of you for attending. And again, a huge thanks to our panel. I've got everybody's contact info and all of that. And I will, as soon as we get this edited, I will be shooting this out over email to our entire email list. And you guys I hope you all will reach out to each other and keep the conversation going.